DocTalk is brought to you by Merck Animal Health. At Merck Animal Health, we're shaping the future of animal health with pioneering science, connected technology, and insights-driven solutions to bring our customers an unparalleled portfolio of choices to improve cattle care and operational efficiency. We support you and your legacy by helping you meet the challenges of today with the innovations of tomorrow.
Hey folks, welcome to DocTalk. We're going to have a great show. We're going to talk about something we do every day in the beef industry, and that's castrate calves. We're going to talk about when we do it, why we do it, and some new technology that's on the market to help us do it better. Thanks for watching and stay tuned.
When you spot BRD in your cattle, that's your golden opportunity to target infection and its associated fever with a single dose of Resflor Gold, the industry standard dual therapy. To learn more, talk to your Merck Animal Health rep or your vet and see label at resflorgold.com. Animals intended for human consumption must not be slaughtered within 38 days of treatment. This product is not approved for use in female dairy cattle 20 months of age or older, including dry dairy cows.
Hey folks, welcome to DocTalk. I'm Dr. Dan Thomson. I'm glad you joined us today. I'm a veterinarian and I work at Production Animal Consultation, which is a veterinary group that provides veterinary care for beef operations all across the United States, from our pack network that's covering cow-calf, around 1 million head of pairs in the U.S., to our feedlot group, where we have veterinarians that cover nearly 30% of the cattle on feed. Very fortunate to be a part of that, and also one of the owners here at Farming Unlimited. Today we're going to talk about castration of bull calves, and it's been something that I've talked about quite a bit in the talks across the country on when we castrate, why we castrate. And some of the reasons why we castrate is that, really in the U.S. and Canada are the two places where castrating bulls prior to going into the feed yard is a standard practice, or when they arrive at the feed yard is a standard practice. We prefer it to happen before they get to the feedlot. But we do it because we want to decrease the activity of the bulls riding each other in social distress and riding each other in some of the different sexual behavioral things that go on when you pin animals that are not used to each other and come into the pen. The other one is to improve carcass quality. We want to improve tenderness. We want to improve the ease of pulling hides off the carcass. That castration tends to lead to a more tender carcass and one that the hides come off. It also decreases the amount of dark cutting beef. But the question I get a lot of time is, when should I castrate? And the point in time that here's my general philosophy is, the younger the better. Because at the end of the day, what I tell students all the time is that the longer the testicles are attached to the bull, the more attached the bull becomes of the testicles, okay? And so as we think about castration, we want to castrate these calves as babies. It's when it's the easiest on these animals. Now, I'll have some people say, well, I don't want to castrate these bull calves at birth. I want to leave the testicles on them and cut them when I wean, because I want added performance. Well, the truth is there is no added performance, because to have added performance from leaving the testicles on the calves, those testicles have to be producing testosterone, which is the hormone that increases growth rate. Well, testosterone is not produced by the bull's testicles until they hit 7 to 10 months of age, and that's puberty. And that's after we have weaned them. There are studies from the University of Florida, Kansas State University, University of Arkansas, and more that show castrating those calves during the first week of life has no disadvantage to performance if you wait to castrate them at the time of weaning. Now, there are some disadvantages if you wait to castrate those calves at the time of weaning, because we can show you that calves that come into the feed yard that have not been castrated, number one, we just heard from the superior livestock data that when we have those calves properly prepared and castrated prior to coming to the feedlot, you will get an increase in the price for those calves of up to $20 a hundredweight. Okay? Now, there's a reason, because when those calves get to the feed yard and they need to be castrated on arrival at processing, what we will see is added stress. That added stress leads to increased morbidity or pull rates or sickness rates for respiratory disease, and that increase in pull rates comes up to, we will see 150 to 200% the death loss in non-castrated bull calves that have to be castrated at processing at the feed yard compared to ones that were taken care of, managed properly well before arrival. Okay, so castrate early. There's no added performance of leaving the testicles on until those calves are weaned. But there is a huge impact that when we have to castrate those calves at processing at the feed yard, where we see increased sickness and increased death loss. Now, when we come back, we're going to talk about some of the techniques. You're watching DocTalk, and I'm glad you joined us. Hey folks, I'm Dr. Dan, and welcome to the Neogen Cattle Intel. And today we're going to talk about lice control. And when we talk about lice control, the first thing you need to understand is that there's two types of lice. There are biting lice and there are sucking lice. I know what you're thinking, all lice suck. But when we start to think about lice control in cattle, when we have products like Ivomec injectable, they do well at getting sucking lice, but they don't hit the biting lice. Therefore, we need to use some sort of pour-on product, whether it's a pyrethrin or an ivermectin or different type, that will get the biting lice as well. Remember, biting lice are more of an issue in the fall and in the winter than they are in the summer. Lice love cold, dark, wet climates. So this has been your Cattle Intel by Neogen.
Are you a cattle feeder looking to manage for a stronger and more profitable set of cattle? Look no further than Igenity Feeder. Igenity Feeder utilizes DNA to gain insight into your cattle's genomic potential, with the information to predict performance, quality, and economic endpoints for cattle feeders. Animals are scored and ranked in a simple format, driving more precise and accurate management decisions. Igenity Feeder gives you the power to predict days on feed, manage variability within lots, characterize carcass performance, and focus on metrics important to you and your operation. With the data provided, you will identify superior animals earlier and maintain high operational efficiency. Maximize your profit and optimize performance with Igenity Feeder.
When the ones who have your heart need your help, count on us for everything they deserve, delivered fast. We'll work hard for you so you can work hard for your dreams.
Hey folks, welcome back to DocTalk. I'm Dr. Dan Thomson. I'm a veterinarian. I live in Kansas and travel the U.S. working at the beef industry, from cow-calf ranches to feedlots to packers to retail, and we enjoy what we do. We're glad we get to do the show here at Farming Unlimited for you every week, and we appreciate you watching. When we left, we were talking about castration. Got to do it when these calves are young. We do it for improved carcass quality. We do it for keeping our fences up and bulls not fighting and riding each other. We do it at a young age, and we dang sure get it done before those calves go to the feed yard to decrease the stress. So how do we do it? There are a couple of different ways, and it's dependent on the weight of the animals. And what we see for baby animals within that first week, the two methods are a lastrate or bander or knife cut. Okay, and then when they get older, we can still use those two different techniques to band or to knife cut, but then there are some different apparatuses that we can use to perform those procedures. When we band an animal that's under 250 pounds, a calf, we'll use an elastrator. The elastrator is a tool that you can see here that just opens up this band. You slip it over the scrotum and the testicles. The one thing I tell the students, to run this piece of equipment and properly castrate, you do have to be able to count to 2. Okay, so you have to make sure both testicles are below the band. You let off the band, and then it cuts off the circulation, and then in 21 to 28 days they fall off. If you're going to use a knife cut, we'll simply cut off the bottom half of the scrotum, and we'll be able to then remove the testicles by pulling and teasing those testicles away from the body as we break down the tunic cord, which is the muscle, and then break off the testicle. As the calves grow older, the scrotum gets larger. There's a knife that's shown here. There's a Newberry knife that can be used to transection the scrotum and open that up so that both testicles are exposed when we knife cut. As bulls get even larger, there is different ways to remove those testicles. One is using a emasculator, which an emasculator we use in a lot of different castration techniques, and we use that, and it has a cutting side that's away from the animal, and it has a crushing side that is towards the animal. And so when you squeeze with the emasculator, you're going to be crushing that blood vessel, and you're going to be cutting below it. The other one, to get the testicle off, would be to use a Henderson stone tool. Attaches to a drill. After the testicles are exposed in these larger bulls, it will actually, on the drill, will actually wind that testicle on itself and tie that cord off. It's a great technique to use on large bulls. We use it on medium-sized bulls as well. If we're going to band animals as they get bigger and they go over 250 pounds, we'll then go to a different type of bander that is built for larger ones. The Calicrate bander, Easy bander, all these different banders are available and can be utilized to castrate. One of the things that people have found is that actually transecting the scrotum after applying the band will help relieve some of the pressure in these bulls, and VRCS has shown that there has been an improvement in some of the performance and some of the decrease in some of the things that can go wrong or complications of banding. When we come back, now that we've talked about the different techniques, we're going to talk about some of the complications that can occur when using these different procedures. You're watching DocTalk, and we're glad you joined us.
Meet Vault, EverAg's all-in-one risk management platform built to bring clarity and confidence to every decision. With Vault on your mobile device, you get a fast, easy view of the numbers that matter most. Real-time percent hedged, P&L performance, current market data, and more. Vault is here for cattle producers, ready when you are. Download the app for iOS or Android today and take more control of your operations risk management.
Success in the cattle business hinges on a lot of different people playing their part. From the vet to the cowboy and the nutritionist to the feed truck driver, you rely on them to get their job done right, and so do your cattle. Your expectations for the vaccines you use should be no different. Bimeda's cattle vaccines were developed and are made and sold by men and women in the cattle business. No smoke and mirrors, just real-world protection that you can rely on. Go to BimedaBiologicals.com to learn more.
In the livestock industry, castration is a common practice to ensure proper herd management. All methods are painful, regardless of the age of the animal. At Solvit, we could not ignore the clear industry need for better castration solutions. So we developed LidoBand, a novel lidocaine-impregnated elastrator, addressing the pain associated with band castration. It provides local anesthesia throughout the castration process. LidoBand, a small device that can make a big difference.
They're here, they're hungry, and they can't be stopped with ivermectin. Choose Safeguard when you deworm your cattle to take out resistant parasites like brown stomach worm, Cooperia, Nematodiris, and others. With Safeguard's efficacy, you can kill more resistant worms in your cattle, so you don't leave potential on the table. Consult your veterinarian for the diagnosis and treatment of parasitism. Then bite back at safeguardworks.com.
Hey folks, welcome back to DocTalk. I'm Dr. Dan Thomson, and we're talking about castration. And we have bloodless techniques and we have surgical techniques. And the bloodless techniques are banders. And if they're under 250 pounds, we use the little Cheerio elastrator band. If they're over 250 pounds and we're going to band those animals, we're going to use a larger banding apparatus like a Calicrate or Easy Band, something to that. But Calicrate's the most popular. After we hit from from the bloodless to the surgical, that means we're going to knife cut. Baby calves, cut the bottom half of the scrotum off. We're going to remove the testicles. As the calves get bigger, there's more impact of hemorrhage, so we're going to use some different tools. Number one, to transect, the Newberry knife to transect the scrotum, expose the testicles, and then we're going to use an emasculator that crushes the tissue to stop the hemorrhage, cuts below it, remove the testicle, and then we're going to also, on the bigger bulls, use the Henderson stone, which is the thing that goes in the cordless drill. We're going to snap that on, the testicle spins off on itself, ties itself off, and decreases hemorrhage, okay? But we have some complications, and the number one complication with knife cut is going to be hemorrhage. If we have hemorrhage, okay, what you want to do is you're going to pack that scrotum with gauze, and then you're either going to surgically sew the bottom of that scrotum against the gauze, or we'll use a bander to band off below that area, that gauze, and that keeps pressure, keeps the bleeding from the hemorrhage from occurring as readily. And just remember to go back, the next couple of days, and you have to remove that band and that gauze, because you don't want that to go to the processor. When we have blood or we have hemorrhage and we do surgical castration, one of the big things you need to prevent against is flies. And so having fly tags in the calves, but putting a fly repellent on that surgical site is important, okay? Now, when we have bloodless techniques or banding, one of the things we want to do is that when we had used the bloodless techniques, we want to vaccinate calves not just for blackleg, but also for tetanus. Tetanus is in the soil. It's a Clostridium species, and when we give a tetanus toxoid, the timing of the toxoid takes about 7 to 10 days to be effective, and that's about the time we see complications with tetanus if we're going to have it. Work with your local veterinarian to know if you have it in the area and that. Another thing that we can get with a problem with banding is you do have to make sure you have both testicles on those little calves below the scrotum, so that we don't put a testicle up against the belly. And we can get and watch these on the bigger calves. Make sure that the scrotums and the testicles fall off. Usually it's a 14 to 28 day process, okay? And so we want to make sure when you get out there to 28 days and they haven't come off, you may want to bring that calf in, take a look at it. We don't want an incomplete castration. That can lead to some complications as well. Regardless of the technique we use, whether it's bloodless or whether it's knife cut. And I know a lot of people say, well, I'm not going to use a knife because I don't want to have the risk of hemorrhage. Well, we probably have as many cattle have as many complications to banding as we do knife cut. The difference is when you have a problem due to knife cut castration, it's immediate, right? It's hemorrhage. And so I see it happening right now because I just got done doing this. Where on the other hand, with the banders with peritonitis and incomplete castration, by not getting it tight enough, we see those complications, 30, 40 days post-procedure, and we don't always associate it with something that we did back at the processing barn or when we were working those calves. So many different techniques, many reasons to do it. Want to do it as young as possible. Different techniques have different complications. And so when we come back, we're going to talk a little bit about pain control and castration, which is something that we're seeing on a public perception. We're glad you're watching DocTalk. We'll be right back.
When it comes to treating BRD, you want a product that you can count on to get the job done at an affordable price. Macrocin by Bimeda delivers on both. A straight-shooting, no BS tulathromycin that does what it's supposed to do. End of story. You don't need to take our word for it though. Go to macrocin.com for customer testimonials and head-to-head trial results. For your cattle and your bottom line, choose Macrocin.
Meet Vault, EverAg's all-in-one risk management platform built to bring clarity and confidence to every decision. With Vault on your mobile device, you get a fast, easy view of the numbers that matter most. Real-time percent hedged, P&L performance, current market data, and more. Vault is here for cattle producers, ready when you are. Download the app for iOS or Android today and take more control of your operations risk management.
When the ones who have your heart need your help, count on us for everything they deserve, delivered fast. We'll work hard for you so you can work hard for your dreams.
Hey folks, welcome back to DocTalk. I'm Dr. Dan Thomson, and we're glad to be able to bring this show to you every week. And we're talking about castration, and we're talking about different ages of and as I told you, that the older they get, the more pain and more complications are associated with castration. We would love to see calves castrated in the first week, and we would love to see them, definitely see them castrated and managed well before they get to the feedlot, okay? And so one of the things that when we talk about animal welfare in the beef industry, and we talk about stress, and we talk about animals' improved performance due to decreased stress and decreasing the pain, painful procedures comes up all the time. Whether you're at the American Association of Bovine Practitioners or at the Academy of Veterinary Consultants, we're constantly talking about pain control when we do some of these typical animal husbandry procedures such as dehorning and castrating, okay? So today the recommendation on castration is to circumferentially do injections around the neck of the scrotum with lidocaine, and then put some lidocaine into each spermatic cord of each testicle before doing the procedure. And lidocaine is kind of like Novocaine. You know, the dentist doesn't come in, put the Novocaine in your jaw, and then just start drilling, right? They put the Novocaine in, they wait 5 to 10 minutes, and that's been part of the problem with application of lidocaine at the time of surgical castration. We don't give lidocaine at the time of bloodless castration because the pain associated a lot of times with banding occurs at 4, 5, 6 days later. So it's been pretty fun lately. We've worked with a group, Solvet, which has a lidoband, and this is at the beginning is an elastrator bander for the young calves at 250 pounds or less. And when we start to use this, these bands, these Cheerio bands, are impregnated with lidocaine. So we band that calf, and it has the lidocaine in the rubber, and it feeds that lidocaine to the site to decrease the pain. And so now a bloodless technique that has the analgesic properties, put this band on, and the lidocaine is delivered over time and is spaced out and helps prevent the pain of banding that calf, which then improves its suckling, which then decreases the stress, which then improves the performance, right? It also is a great animal welfare story that if we're going to do it and we have the ability, we don't have to carry the bottles of lidocaine with us. We don't have to stick ourselves in the finger with the needles underneath the chute. Today, these are only available for the under 250 pound calves, but they have products coming out with the other banding techniques that will have the delayed release lidocaine that will help with, I believe, a lot of the ills that we see when these calves get arrived at the feed yard. But anyway, it's been a lot of fun. You can see we've done it out in the field, and a great tool that's going to be for our industry, and I see it being used widely across the beef industry. We're looking for ways to decrease stress, decrease pain, and improve animal welfare in animals. We have some new technology that's come out, and we in the beef industry are going to benefit by improving the welfare of the calves, decreasing the pain, decreasing the stress. Leads to increased suckling. It leads to decreased respiratory disease, and all the above. So take these into stride, take these as advisement, and we've got a lot of good technology coming down the road. Remember, always work with your local veterinarian. And if you want to find out more about us at DocTalk, you can find us on the web at www.doctalktv.com. It's been a pleasure to visit with you today. I'm Dr. Dan Thomson, and I'll see you down the road.
At Merck Animal Health, we're shaping the future of animal health with pioneering science, connected technology, and insights-driven solutions to bring our customers an unparalleled portfolio of choices to improve cattle care and operational efficiency. We support you and your legacy by helping you meet the challenges of today with the innovations of tomorrow.
Time is money on the farm, and your cows are less productive when they're stressed. The Alertus on-farm test from IDEXX allows you to quickly test cowside and identify open or pregnant cows within minutes on your schedule in the parlor, barn, or chute. It's more efficient for your farm, very simple to use, and puts you in control. With minimal training and reliable, fast results, sample-based pregnancy testing is better for beef and dairy producers. Learn more at idexx.com/DocTalk.